So I gave a lecture at the 2015 annual meeting for the AAD. Dr. Bruce Strober invited me to speak about the risks of infection, cancer, and MACE, which is defined as major adverse cardiovascular events in patients on a biologic. So I reviewed 3 large registries that looked at the biologics. So ustekinumab was just approved 2 months ago, so we don't have any long-term registries for that yet. In SOLAR, it's a large registry, the world's largest registry specific for dermatology. They enrolled 12,000 patients, and they've been following them for 3 or 4 years now. The patients can be on any systemic therapy, so not only just infliximab or ustekinumab, but they can be on any systemic therapy. So in their registry, they did not find that there's an increased risk of cancer in these patients. When looking at ustekinumab versus non-biologics, they also found that there's no increased risk of cancer in patients who had other biologics versus non-biologics. And then they also looked at all biologics versus non-biologics. There's no increased risk of cancer. When looking at infection, they found that ustekinumab did not have an increased risk of infection compared to those on non-biologics. Interestingly, they found that other biologics, which included mostly etanercept and adalimumab, had a 2-fold increased risk of infection compared to non-biologics. And then when they looked at all biologics grouped together, there was no increased risk of infection. Moving on to OBSERVE-5. OBSERVE-5 is a 5-year registry that followed patients who had at least one baseline dose of etanercept. So they had 2,500 patients enrolled in this 5-year registry. They compared it to the MarketScan database. The MarketScan database is a very nice marker of the general population of the US. It has 180 million patients as of 1995. And so they compared the groups of patients on Embro and OBSERVE-5 versus patients not on a biologic, on a non-biologic therapy in MarketScan, and they found that these patients did not have an increased risk of infection or malignancy. ESPRIT is a 10-year registry that follows patients on at least one baseline dose of adalimumab, and these patients were also followed over time. We have enrolled over 6,000 patients throughout the world, and I was fortunate enough to enroll 92 patients in this registry. We looked at some posters presented here at this AAD looking at infection and at cancer. There are relatively low numbers of event rates in terms of cancer and infection, about 1 event or 0.9 events, infection and cancer respectively, per 100 patient year. So these are relatively low numbers of raw data, so these are reassuring to me. We also looked at 2 large retrospective cohorts done by SABRE. SABRE is a group that put together large cohorts from Northern California Kaiser, Medicare, Medicaid, and so they had looked at infection first. So in that study they had 16,000 patients on a TNF inhibitor. They did not look at ustekinumab, and these patients had all the indications for a biologic. So they had patients with psoriasis, psoriatic arthritis, ankylosing spondylitis, and rheumatoid arthritis. So they matched them 1-to-1 to patients without a biologic. So they looked at patients who had new TNF inhibitor use. So in this study, they also found that there is no significant increased risk of infection compared to the non-biologic in psoriasis, rheumatoid arthritis, and inflammatory bowel disease. Now, SABRE also looked at even larger number of patients in terms of cancer. They looked at 25,000 patients on a TNF inhibitor for these indications. It's the same thing. They looked at the incidence of cancer, internal cancer, and also skin cancers, and they also found that there's no increased risk of cancer in these patients. So after looking at these 3 long-term registries and these 2 large retrospective cohorts, I would like to conclude that there's so far no increased risk of infection or cancer using these 4 biologic medications.